There are occasions, such as a mass casualty event or sudden surge in patients or the appearance of an emergent patient, where the full registration process might take too long. Additionally, there are occasions where a full medical record should not be required, but the information from that encounter still needs to be recorded. The Rapid Encounter module of EMR was created for these purposes. The Rapid Encounter portion of EMR has 4 primary functions, which are tracking family and friends for a patient, tracking first aid encounters, allowing for quick entry of an emergent patient, or rapid entry of numerous patients that arrive at one time. A family member, friend, or caregiver of a patient can be entered as a non-patient for tracking and accountability purposes. This will be particularly helpful in an FMS setting if the caregiver is occupying a bed. The second function is tracking first aid encounters. EMR allows us to obtain basic information when performing simple first aid, such as giving somebody a Band-Aid. Lastly, the treatment portion of Rapid Encounter allows for quick entry of an emergent patient or the rapid entry of numerous patients that arrive at the same time. The Rapid Encounter module of EMR is accessed from the main menu screen. To use Rapid Encounter for patient registration, you must first enter a last name and a first name for the patient. If the individual's name is unknown, there are 2 buttons to the left of the last name field that can be selected to create a John or Jane Doe patient. Creating a John or Jane Doe also fills in the gender specific for John or Jane. When a John or Jane Doe patient is created, a sequential number is added to the record, so you'll be able to differentiate between the John and Jane Does. Either an age or date of birth is required. It is preferred that a date of birth is entered. However, if you cannot obtain a date of birth, you can always estimate an age by selecting the age button. The age will default to years, but you can select months, weeks, days, hours, or even minutes. If the date of birth is discovered later, it can be added and the age will automatically be updated. The gender field in the Rapid Encounter defaults to unknown. It is helpful for statistical purposes and data gathering for situational awareness if the gender fields are accurately represented. If time allows, you should enter the appropriate gender for the patient. The external system ID or barcode field is where users can enter a triage tag number or other identifier. This can be done manually or with a barcode scanner. In order to register a non-patient, you should enter last name, first name, gender, and date of birth. After this information is entered, tap on the Register as Non-Patient button. If there is a possible match, the Possible Duplicate Patient screen will appear. The Possible Duplicate Patient screen shows existing patients in the system based on name, age, date of birth, address, external ID tag or barcode, or social security similarities. If a record comes up for a patient that is not closed out, you can click Continue to add existing information to the patient record. If a record comes up for a patient that has been closed out, the user can click Add Visit to add a new record for that patient. If the current patient does not come up in the duplicate patient check, you can click No Patients Match to continue with the registration process. When you click No Patients Match, a record created box appears with the message Non-Patient Record Created. Clicking on OK will clear the Rapid Encounter screen and allow additional patients to be registered. Non-patients can be linked to patients in the Medical Services section of EMR. Further demographic information for the non-patient can be entered into the individual's record in the Medical Services section of EMR as well. Should a non-patient need medical treatment during his or her stay, you can convert them to a patient by tapping on the Add Visit button located on the patient dashboard. The information that has already been added, including relationships, is carried over and a medical record is started. When creating a first aid encounter in the Rapid Encounter section, you should enter last name, first name, gender, and date of birth. Once this information has been added, you should then tap on the First Aid button. The Possible Duplicate Patient screen will appear. If the current patient does not come up in the duplicate patient check, click the No Patients Match button to continue to the registration process and move on to the First Aid screen. The Patient Info tab on the left side of the First Aid screen shows the information that has already been entered for the first aid patient. To add additional information, tap on the pencil next to the patient's name. When the Edit Patient's Info screen opens, the patient's information can be updated. The patient's photo can be taken at this time if you're using a device that has an integrated camera, such as a Panasonic U1 or H1. To take the patient's photo, click on the No Photo box, and this will activate the computer's camera. The Chief Complaint field is pink and at the top of the first aid screen and must be entered. In the center of the screen are the Dispense Items and Notes tabs. Multiple notes can be added for a first aid visit. Selecting the Notes tab allows you to enter a note about the patient's visit. Once a note has been entered, tap on the Add button to save the note. The note will be displayed on the screen along with the date and time of the creator. You can select an item from the drop-down box to administer to the patient. Once an item has been selected, you can enter the desired quantity needed and dispense it to the patient by tapping the Dispense button. In order for items to be available in the first aid drop-down, the item has to be flagged as available for first aid by the pharmacist. This is accomplished through the pharmacy dashboard, available only to pharmacists and pharmacy techs. Tapping the Next Patient button at the bottom of the screen saves the information and returns the user to the Rapid Encounter screen. The third method for quickly registering a patient through the Rapid Encounter screen is the Treatment button. This method was designed for quick registration, whether if it was for an emergent patient or when trying to register many patients quickly. The minimum information needed to progress to the treatment screen from the Rapid Encounter screen is the first and last name, gender, date of birth or age. Additional information should be entered if it is available. Once the required information has been entered, you should select the Treatment button to create a medical record for the patient. The possible duplicate patient screen may appear. If the current patient is not found in the Duplicate Patients check, you can click the No Patients Match button to continue the registration process and move on to the Rapid Treatment screen. After you select the Treatment button, the Rapid Encounter treatment screen is displayed. The minimum information needed for this screen is the chief complaint and patient acuity. The patient's photo can also be taken at this time if you're using a device that has an integrated camera, such as a Panasonic U1 or H1. To take the patient's photo, click on the No Photo box, and this will activate the computer's camera. Once this information is entered, tap on the Continue button at the bottom of the screen, and this will take you to the next page of the Rapid Encounter treatment screen. If you're attempting to register a large number of patients at one time, tap on the Next Patient button located at the bottom right-hand corner of the screen, and then tap the Save and Continue button. This will bring up the Default Values to Unknown window. This window asks you to default allergies and medications to unknown, or to return to the screen and enter the appropriate information. In this case, you are ready to register another patient, so tap the Default to Unknown button. Here you have the ability to print up to 10 triage labels for each patient if the computer is connected to a label printer. After you select the desired number of labels, tap on Continue to return to the Rapid Encounter screen. There are some instances when a critical or emergent patient should be entered through Rapid Encounter. In these cases, you will register the patient in the same manner as registering patients from a large group. However, when you reach the treatment screen of Rapid Encounter, additional information can be entered. On the left side of the Rapid Encounter treatment screen is the Patient Info tab. By tapping on the pencil button, additional demographic information about the patient can be added. Initial vitals can be entered in this section directly below the Patient's Info section. You can enter values for vitals by tapping on the buttons to add information. You can also backdate the time by updating the Time button, which is located at the bottom of the list. Instead of going to the next patient, we can do a primary survey on this patient. By tapping through the 7 primary checks on the left side of the tab, we can do a brief assessment of our patient. This works similarly to the physical exam function in EMR. The Secondary Survey tab contains tabs to enter allergies and medications, as well as past medical history and history of present illness. You can add a note by tapping on the Notes tab. The Notes tab can also be used to record information that may be happening quickly. Tapping on the Orders tab allows for orders to be placed for the patient. This is the same screen that is seen during the standard patient treatment process in EMR. The Disposition tab contains the diagnosis or clinical impression, disposition, disposition via, and the discharge fields. These are the same fields seen during the standard patient disposition process in EMR. At any time, the Next Patient button can be selected. Once you move on to the next patient, the current patient's record can then be accessed through the medical services for additional information to be added to the patient's encounter. This concludes the basic EMR application module. Please let us know if there are any improvements that can be made to this course. Now, good luck on your exam.